I'm Lauren Mansell. I'm a physical therapist who specializes in lymphedema, oncology, and pelvic rehab. So that's any issues with bowel, bladder, or sexual function. And today I am going to give you some information and education on dilating, which is everyone's least favorite part of this whole experience. So, for dilating, you were probably given a hard plastic dilator from your physician, which is fantastic. This is the extra small. This is the hard plastic Syracuse, which is nice because it can stay nice and clean. You don't have to worry about what lube you use. Depending on what you're dilating with, if it's silicone, it will depend on whether or not you need a water-based or a silicone lubricant. So for today, we are just using the Syracuse dilator. And I'm also going to show you that you can do other things to help with pain, one of which is using a glove, a disposable glove that I have stuffed Kleenex in. So it's pretty easy to do. You're going to roll that ball of Kleenex up. You're going to place it in the glove. And so this makes a slightly less firm dilator, but you can use this, and it also has a handle here. So you can knot this. Another thing you can do too is create a dilator out of ice, which we are currently making. So once that comes to market, we will let you know. But there are many ways to help decrease your pain for dilating. So the setup, the best way to dilate is to be super comfortable and to minimize any muscle activity in your trunk or your abdomen, and then also if you're moving on your trunk, your pelvic floor has to stabilize. So the muscles here will actually be contracting when you're trying to place a dilator through them, which is very uncomfortable. So for our setup, we are in a clinic, and I know you don't dilate in a clinic, but at your home, kind of setting up your bed and or a couch can be the most, or even on the floor. We want you kind of lying down, supported. So I have a lot of pillows here to really bring my trunk up, and then I have leg support here. So the best pillows are like the firm ones from your couch, the big foam ones, or throw pillows that are nice and firm. Build up, because you could always take away, throw a sheet down, and then also because, people aren't really talking about this, but dilating, you can bleed with dilating. So have your towel down, just so any bleeding can be minimized and there's less stress with that. Then you're going to get undressed from the waist down. I will not for this purposes, but I'll be showing you how I would be dilating. Note too, you can use this ice prior and after to kind of numb the area a little bit. Just talk with your physician, make sure it's okay. And then another really helpful tip, so I'm going to place, this is my water-based lube. My favorite is slippery stuff. There's 3 things you want to look for in a lube: pH, osmolality, and then the ingredients. I have a 7-page paper if you want it. But just know that slippery stuff is very good in all 3 things. I would throw away any KY jelly or Astroglide that you have. If it's the only thing you have to dilate until you can do that, but just know that it's really important to have a very good lube. So this is slippery stuff. It's my favorite. It's a water-based and safe. So I'm going to place that and some of my dilating objects over here to the side. So small I lost it. Know too that besides ice to numb, you can speak with your physician or your care team about possibly using a lidocaine. We've gotten lidocaine through the pharmacy, but you can also get it as over-the-counter in aspirin. And then this is a very large syringe. I apologize, it doesn't need to be this large. You could do this small syringe. But then what you would do is you would syringe a little bit of the lidocaine, again, talk with your physician and your pharmacist, and then I'll show you in a second how you would insert that. But you would prep it by creating the milliliters that they want of whichever kind of numbing agent that you may want to use. So for purposes, I just put a little bit in there. So when you are starting to get comfortable for dilating, you want to get your legs nice and supported, and you also want a nice wide leg if it's comfortable and available. We we can actually use a couple more pillows. Pillows do kind of puff down. So if you're on the couch, you can kind of, something like this is much better because then you only have to reach here. Whereas when I'm down like this, I may, anytime that you're reaching or lifting up with your abdominals, this is not going to help you dilate. It's going to make it a little bit more painful. So for the area, and hopefully you've gone through this with either your physical therapist or your physician, when you don't have any clothes on, when you're going to dilate, you want to open up the vulva, the area, and you're going to kind of place at the very top. You'll feel your pubic bone. Underneath that, you'll feel kind of that little bead is the clitoris. Underneath that, you may feel your urethra. Doesn't look like being palpated, and then the opening of the vagina. So that's what you're really going for, is that opening for the vagina. And you can, again, please work with your physical therapist on this. We get mirrors out and we look and we show, we do a lot of education to show you about the landmarks and how to find. So when you know the exact location of where you need, if you're using a little bit of ice, so we'll pretend that this is ice, so that would be knotted. You can place the ice into the vagina. It's very cold at first. It melts pretty fast. I've been using ice this way for many years actually, and I haven't had any issues from it. But again, speak with your physician. You can have a little numbing of that ice first, and you do want to place a nice dollop of the slippery stuff onto the edge of your glove. Place a nice big dollop. You can even stick the dilator into the packet, or if you have a pump, very easy to do. You're going to place that, open up the two lips, find the opening of the vagina, and you're going to place the ice or whatever you can do. Ice to numb, that was what that one just showed. You can also use your little syringe of lidocaine that you place. Again, there's an opening here. You may have to kind of hold it so it doesn't leak out. Place it in the opening, and then you just squirt it in. You might have a little bit come out, but again, that's why we use those towels and everything around. Let that sit. So when I'm working with patients and they need lidocaine, I will have them insert the lidocaine into their vagina and then have them do deep belly breathing, have them do belly massage. I'll help them do kind of lymphatic drainage if there's any swelling, or if we want to reduce lymphedema or prevent it. So all for 5 minutes. You just want some kind of relaxation, deep breathing while that lidocaine is numbing everything. Then you get your dilator. You can either I don't use the packets that much, but I never reuse packets. But if you just open this up, you can place the dilator into the packet. Now, if you did ice, just ice, or use the lidocaine, you may find that it's already slick enough. I use the pump, the slippery stuff pump. So I just do I'll do a pump, and then I'll put it onto the dilator. And then open, find the area again, your landmarks. You have your pubic bone on top, clitoris right under, the urethra right under that, and then the opening of the vagina. And you're going to find, so instead of kind of looking and kind of lifting up like this, I strongly recommend you're nice and relaxed. You place the dilator into the opening of the vagina, and as you breathe nice and softly, you can kind of place it in gently and even turn it as you're placing it. So it's looking kind of like this. As you place it into the vagina. One more time. So one thing that happens a lot is it'll come out either from high tone, from breathing, from increased intra-abdominal pressure. So I'm just kind of showing you that this is what it would look like placed into my vagina. And then you can wrap a towel and just place it kind of inside the legs like that to hold the end of the dilator in. Depending on who you read, what you read, you can do a couple different things at this point. I usually just tell my patients, insert, get a book out, get your phone make it enjoyable time. Every once in a while you can kind of turn it. But that's something that we've seen in the research is where you just do like a 45-degree turn, 90 degrees or so, excuse me, 90 degrees, just a quarter turn. You can also, if you find that there's bands or you're working with a physical therapist and you know you have that fibrosis in some areas, you can actually direct the dilator into that area. So if you know you're tighter on the left more than the right side, you can direct this dilator and start breaking up some of that scar tissue and that fibrosis. You don't have to, again, you can work with your physical therapist to do that, but these are options for you to improve the quality of the connective tissue care after having radiation. So I try to get my patients to dilate at least 5 minutes. If they can do it on a daily basis, great. If it doesn't work into their schedule, if they're at least getting 3-4 times a week, there's no guilt or shame, and there's no really great evidence either looking at duration and frequency. We're collecting that data now. It's more important, I feel, for you to have an understanding of your body and to create a scenario that makes this easy and pain-free. So with the dilating, after you've done 5 minutes, you can do longer, great. If you're turning, great. If you're kind of directing it, massaging, great. I also do like to recommend having either before or after. Facilitated orgasm is really important if that's something that is important to you. Orgasms can help increase the feelings of wellness and sexual satisfaction and just a little bit of reclaiming of this area. So before dilating, after dilating, I usually recommend either a bullet or the Famani wand is fantastic. And essentially the Famani wand is a little bit larger than this with a battery that vibrates that you can place on your clitoris. So you can facilitate an orgasm externally just by either stroking with your finger or using something vibrating on the clitoris. So it's very important. This is something we're just really not talking about, is how important this activity is for your nerves and your blood flow. So we have dilating, we have positioning yourself. Notice never once did I kind of lift up and do any abdominal crunches. I'm trying to direct this as comfortable as possible. I think if I was even a little bit more upright and supported, this would be even way easier for me to dilate with, but again, the pillows would poof a little. Know that the more you are here and the more you are here, the easier it will be, the more supported you are under your shoulders and your knees, the more comfortable it will be to dilate. Dilating, these are really easy to keep clean if you're using a glove. So let's go back to my glove that had first we pretended it had ice in it. Now we're back to this is stuffed with Kleenex. I can place this in my vagina and it's very comfortable because where my muscles are, right here, there's nothing keeping the muscles open. So this is nice, and this is a very good option. Again, we're working on some products to make this easier for you. So you can do dilating with a glove. You can place ice in it that's hard. You can actually put, I'll just use another finger. If you're really worried about cleaning up stuff, you can also put the dilator in a glove and place it that way. If you have towels down, just know that it is going to be a little messy. Know that hydrogen peroxide is great for getting blood out. So have some dark colored towels around so that when there is a little bit of that bleeding that comes with dilating, know that A, it's normal. Copious amounts is not, but a little bit of tingy blood is completely normal with dilating. Again, working with your care team, working with your physical therapist can really help you individually understand what is correct for your body. Dilating, you can use gloves that you can just throw in the garbage. If you use it just like this, you just wash it with soap and water before, dry it really well. The vagina is very acidic, so we don't want to add anything really bad to the area, but just know that the vagina is made for combating bacteria and invaders, so you don't have to get You want it to be clean. You don't have to obsess about how you're dilating. Let's make sure soap and water, nice and clean. Wash it after and before you go to dilate. Use a good lube. Orgasm if possible. Use ice if you need to. Use lidocaine if you need to. Please reach out to a pelvic specialist. That pelvic specialist should be feeling the muscles, looking at the area, talking to you about what's going on. If you're really fortunate and your pelvic therapist is also a certified lymphedema therapist, know that you guys can talk about preventing lymphedema from the radiation and the lymph nodes being removed, just as, while you're taking care of any scar tissue, any difficulty with walking, functioning, bowel, bladder, sexual function, any issues that you have, please reach out to us as physical therapists because we want to help you and help you do these things better and easier and